Okay, let's go ahead and get started. It's 11:30. First, I'd like to introduce Glenda Fauché. She's our ASL interpreter for today. Appreciate you being here. I'd like to start out with just some operational remarks. One thing that I wanted to talk about is I talked to both our 911 director, Richard McGuire, and also spoke to the sheriff before the meeting. As far as they're concerned, normal operations are happening across the parish. There's no unusual activity, no disturbances, just an average day work for them. So I just want to let the public know that from a public safety standpoint, we're considering this to be a normal day. Operations-wise, nothing really has changed since our last briefing. We have some questions that we'll cover later and some comments. But for right now, I'd like to call up Dr. Lacey Cavanaugh to give us the latest medical information.
Hi, good morning, everyone. A few things that I'd like to talk about this morning, and one is that we know and understand how difficult and frustrating that this situation is for all of us here in the community. Whenever you are told don't gather in groups, that goes against the fiber of our being, especially living in Louisiana, which is a place that we enjoy camaraderie. But we have to remember that social distancing is a tried and true and proven technique to reduce transmission of disease during a time like this when we have an outbreak. People are talking a lot about vulnerability, vulnerable citizens, people who have chronic health conditions and how they are higher risk than healthy people to get severe cases of this disease. And that is very true. We definitely have to pay a lot of attention to protecting those folks. But we sort of tend to forget about young, healthy people. Young, healthy people, although they may not get as severe of a case of disease, they are very important in transmission of the disease. So even with very mild symptoms, they can then bring COVID-19, if they have it, to their friends and their family and their loved ones. And so it's important for everyone to socially distance, not just people who have underlying health conditions. So that is definitely a major point that I know is very difficult to do, but I think is extremely important in helping us to do what we keep calling of flattening the curve. Okay. Remember that all of these measures that we have taken to socially distance are, we understand how challenging they are. put it that way. And they don't necessarily stop the eventual spread of COVID-19. What social distancing does is that it slows down the spread so that our healthcare systems, as people do need healthcare for this condition, it slows down the transmission enough that our healthcare systems can keep up with demand. So it helps to protect our healthcare workers when we slow down transmission of disease, so that we can take care of everyone as they need care and provide the best care that is available. So another thing I'd like to talk about is testing. A lot of folks are questioning how accurate is the test for COVID-19. Well, the test is actually what we call a PCR test, which means that it is very accurate. And if you have symptoms and you test negative for COVID-19, it more than likely means you really don't have COVID-19. It is not like some flu tests. Some flu testing that we do out in the community are rapid tests. And so these tests have kind of a track record of when they're positive, it's very helpful because then we know you have the flu. But sometimes when they're negative, you can actually still have the flu and even test negative. And so those rapid flu tests sometimes miss cases. So at this point in time, if you have flu-like symptoms, and you test negative for the flu, and then you get a COVID test, and the COVID test is negative, that could still be the flu. And I think people are having difficulty wrapping their brains around the types of tests and how flu tests are just, at least the ones that we use that are rapid tests, that are point of care tests, that are done in a doctor's office in 15 minutes. Lots of those types of flu tests are just not as sensitive in picking up flu as the COVID test. The COVID test is extremely accurate. So if you test positive, it's almost certainly positive. And if you test negative, it's also almost certainly going to be negative. So I just wanted to bring that up as because we have been getting a lot of questions from the community about what does that testing mean. As you have all seen, there are a significant increase in the number of cases, and we continue to see those numbers rise. Remember that the average time from the time someone is exposed to the virus to the time that they start showing symptoms of the virus is somewhere in the neighborhood of 2 to 14 days, most average around that 5-day window. Okay, and so once you start showing symptoms, you can show symptoms for a whole nother week before you are to the point that you have severe symptoms. Severe symptoms have been developing a little bit later in the course of this illness compared to the flu, right? When you get the flu, you feel it, you know it, you can almost tell exactly what time. I got the flu at 11 o'clock yesterday. You know, people know exactly when it started because it starts so rapidly and so suddenly. But with this, it often starts very mild. People don't even really recognize the fact that they're sick and showing symptoms until it progresses over the course of several days. And so the reason I tell you all of this is that I'm telling you that this is the very beginning of this. So we have 171 cases that have been diagnosed within the state of Louisiana. And we still have potentially another 5 days before we know if people that those folks have come into contact with are going to eventually be positive. And then we still have another 7 days after that we could still have people who were originally exposed by these 171 that could eventually end up with more severe cases. And so what I'm telling you is that this is still going to take a while for this to run through the community, and that is why we have acted so early to stop social distancing and to stop so many community gatherings, is because now is the time that we prevent those cases from ballooning. And even enacting those measures now, we still expect that there probably will be many more cases that will be diagnosed in our community because people have already potentially been exposed, and it may take several days before they become ill. And so I just wanted folks to understand how the virus is transmitted, and that we are kind of at the beginning of the peak of this, and we still have a long way to go. So I don't want people to get the sense that this is going to be over next week. This is going to kind of be a steady incline probably for a while before those social distancing measures that we've already enacted are actually providing benefit for us at the community level. So those are the major things that I wanted to talk about today, and I guess I'll go ahead and take questions.
Well, I'm sorry. Obviously, I'm not very good with these mics. First of all, if people have routine doctor appointments, should they go ahead and keep them? And also, it would be awful if all of our doctors suddenly came down with, a horrible illness. What's being done to protect our doctors?
So our physician offices, many of them have chosen to try to screen folks before entering the office. So lots of them, you may see signage on the doors of various offices that says, please, if you're sick, stop, go to your car, and call and talk to your doctor so that your doctor can decide if it's a risk for you to come into the building or not if you're sick. Individual offices, many of them are ensuring that they mask people who do end up coming into the office that have symptoms, and many are referring people who have symptoms that are compatible with COVID to an off-site testing location. And so there are some measures in place to protect our healthcare workers. Of course, personal protective equipment is a challenge and will probably continue to be a challenge, at least for the near future. But our physician workforce has many other tools at their disposal that they can use to try to keep sick folks out of the office and still provide care for those folks who just need routine care for other conditions.
So you think if someone has an appointment for what would be routine care, they should go ahead and plan on keeping that appointment?
Unless they hear anything different from their own personal physician. Of course, every office is handling it slightly differently, so it's hard to talk about it on a big group because not every office is going to do the same thing. But To me, offices, if they are canceling any sort of routine anything, I'm sure they will let their patients know.
We had a question from one viewer asking if someone is too sick to go out, but maybe not sick enough to show up at a hospital, can someone come to them and test them maybe outside on the front porch or possibly test them through a car window if they can get someone to drive them somewhere?
So in some other communities across Louisiana, there has been some discussion of how to coordinate some sort of drive-through testing site. We've seen and heard about that even at the federal level, but currently at this point in time, there are no sort of resources in place to be able to do that. And one of the challenges there is that there are challenges with supply chains of making sure that we have enough protective equipment and making sure that we have enough of the collection supplies to actually collect the sample and send it off to the lab. And so those are definitely being paid a lot of attention to and being worked out. I expect that over time, those sorts of options are going to eventually be available in some communities, but right now, there is not a mechanism to make that happen.
Do you know anything at this point about how many people from Southwest Louisiana have been tested? And once again, we still have no confirmed cases?
We still have no confirmed cases, and number of people who have been tested total, we don't have those numbers offhand because we only get, like we talked about yesterday, we only get the negative results that are coming from the state lab. So as you can see, we've increased our testing pretty substantially even since yesterday. Yesterday we were in the neighborhood of 300 tests run, and today we're in the neighborhood of 450 tests that have been run across the state. So we know what negatives are coming across from the state lab, but in the private sector, as tests are run, we get notifications of any positives, but we don't get a notification for every negative test that is run. So that is going to be a very difficult number to track, is how many total people have been tested.
How important is it to do things to try to keep your immune system up, and how effective would they be as far as, reducing your chance of getting severe illness?
So how well your immune system works is dependent on a whole host of factors, including your genetics, including your previous health history, including the medicines that you're on. There's no known available vitamin, or if that's what you're asking about.
Or
that
food. There are a lot
right.
of popular articles that say eat almonds, eat avocados. Is, any of that true?
I mean, in general, you should live a healthy lifestyle. So you should eat a balanced diet and follow the recommendations of the CDC and the recommendations of your own personal doctor on how to stay healthy. But yeah, I mean, eating avocados is probably not going to protect us from COVID-19.
Okay, thank you.
There's been people, I guess, on social media who have been kind of critical of a lot of these businesses being shut down, restaurants, bars, casinos. Just, I guess they're kind of calling it an overreaction of sorts. Can you maybe expand upon that a little bit as to what, I guess why people are reacting that way, or maybe defending what the governor did yesterday with those shutdowns?
Sure. So social distancing is one of the only things at this point in time that we really know stops the transmission of the virus. So if you've watched how this has transpired in other countries, for example, Italy, everyone got sick in a pretty short window of time. And so when that happens, then the healthcare system has some pretty serious impacts. And then decisions need to be made when you run out of supplies and resources on who gets care, right? And we never want to have to make those decisions. We want to make sure that everybody gets care, appropriate care, the best quality care when they need it. And to do that, we need to prevent everyone from getting sick at the same time. And so I definitely do not think any of these measures are an overreaction. I think a lot of folks out there are underestimating how serious this virus can be in some people, and how much just in 2 months it has spread. It's a very transmissible virus, and even though most people do great, right, most people have mild symptoms and they recover, there are still a significant number of deaths and people who get sick from this virus. And so we have to, by socially distancing, we are saving lives, and we have to do that early before sustained community transmission. Because if we wait until it is already amongst and deeply embedded into our community, by that point it's too late to socially distance. I think that, yes, we will get more cases before we start. We will still see some acceleration of the number of cases per day before we start to see the number of cases per day trending downward. But hopefully the interactions and the changes that we've made, those restrictions that are in place today, are really going to help us get a grip on this within the next 2 weeks that we're hopeful.
Were you aware that all the dental offices have supposedly closed? Apparently that came from the state.
I have not seen that, but of course the situation is very rapidly evolving, so new information is coming out literally minute to minute. And so once I'm done here, I will certainly check on that. All right, I think that's it for me. I don't know if Liz wants to do a quick hospital update.
Yeah, we'll call it.
Perfect.
Well, I'll tell you what, since we have Liz, would you come up and give us an update on the hospital situation? And state your name and who you work for.
Hi, my name's Liz Harmon. I'm the Administrative Designated Regional Coordinator for Region 5, and I'm the Region 5 Coalition Lead. I wanted to just share that we have opened the hospitals and in collaboration a testing site. The testing site is by referral from your primary care physician. The primary care physician needs to make sure they've questioned you on the CDC guidelines. This is going to help us make sure that we don't overwhelm our ERs and we have good recommendations of getting the right people tested. So please make sure that you call your primary care physician if you have questions. Also, use 211. We have this great opportunity to get your questions answered. So it's 2-in-1 is available and it's 24 hours a day. The other changes are going to visit someone in the hospital. The governor mandated that hospitals limit access to hospitals, and so if you have a loved one that's going to the hospital for treatment or is an inpatient, they can only have one visitor. The hospital said this is going well. Our community is reacting appropriately, and our nursing homes have had to limit visitation too. And that too is going well. They're encouraging you can do FaceTime to visit with your loved one. So please consider those to make this go as easy on our families as possible.
Any questions for Liz?
Thank you.
Okay, thank you, Liz. Next, we've got a couple of elected officials that we'd like to make some comments. Mayor Hunter, if you'd come on up.
Thank you, Dick. Good morning, everyone. I know I have the authority to speak on behalf of certain elected officials because I've met multiple times with every mayor in this parish over the last 72 hours. I'm very confident saying that I speak for every mayor in this parish when I say that we have heard the statements from the federal and the state government, and we are absolutely supportive of those statements and the messages that are attached to those statements. Now is not the time for divisiveness. Now is the time for unity, and we owe it to the public to try and give a very unified and cohesive message and statement. I get it. I am a dad, I am a husband, I'm a business owner. I actually happen to own a restaurant. And I can tell you that we are having a lot of those difficult discussions right now. I'm also a man of faith. I believe in constitutional rights, and I also believe in science and using data to make wise decisions. When a hurricane is coming, you take certain precautions. And I know this is different from a hurricane, but we should be taking certain precautions right now. Those precautions have been laid out to us by the experts, and I think we would be fools not to listen. Thank you. I'll take any questions if there are.
I think you told me you have seen what Congressman Clay Higgins put out, I think on his Facebook page, in which he's critical of the governor and, questioning the various mechanisms that have been put in place, I think particularly concerned about business. What, if any, reaction do you have about that?
I didn't watch his entire statement. I watched a part of it. I'll just say again that my position, and I believe the position of the majority of elected officials in Southwest Louisiana, is we are supportive of the governor's mandates, and we believe, as Dr. Kavanaugh said a moment ago, we're doing things right now to save lives. And how could you be against saving lives?
How concerned are you that the public might see this and perhaps not think it's as big a concern as most people do?
That's why I made some of the statements I just made.
Okay, thank you.
Thank you. Thank you.
Thank you, Mayor. I'd like to call up Mr. John DeRozier, District Attorney of Calcasieu Parish. And I think Teresa had a couple of questions about the availability of the court system services. If you could, Mr. DeRozier.
Thank you. Relative to the criminal justice system, I'm going to talk in terms of today through the 27th of this month. We will be dealing with the aftermath of that before the 27th to move into the future. However, for the time being, until the 27th, all felony trials and misdemeanor trials and court appearances for those two have been suspended. We do not need people, or do not want people to show up at the courthouse. Any cases that have been fixed for that time frame, for example, we have jury trials set for the 23rd of this month. Those have been continued and will not be heard. There will be no misdemeanor trials also during that same time frame, and I expect that at least in misdemeanors, that will be extended. We're going to try and do as much as we can by video, whether it be video conferences or video arrangements made through the jail for people who've been arrested during the interim. And Again, there will be no need to show up at court between now and the 27th unless you are notified to do so. If you have any questions about that and have a lawyer, call your lawyer to discuss those issues. Relative to anyone who is on pretrial diversion through the district attorney's office or on misdemeanor probation through the district attorney's office, it is not necessary to show up for any appointments in the next 30 days. We have suspended all of those operations for the next 30 days, so it is not necessary, and please do not show up at the district attorney's office or at the courthouse for anything relative to those two items. As this ailment situation unfolds, we will have more information. We will give more updates on our website. We will put more updates on social media and through KPLC to make sure everybody's informed as to what their obligations are. So for the time being, let us make sure that we protect the health, safety, and welfare of the people of Calcasieu Parish. Thank you.
So if you have a summons or a subpoena, you're basically off the hook through March 27th, is that what you said?
Any subpoena that has been issued for any particular court proceeding, whether it be a misdemeanor trial or a felony trial, between now and the 27th of March, you did not need to show up at the courthouse for that subpoena.
Is the courthouse open and operating in any capacity?
Very limited capacity.
And what about your office?
We are there, we're open. If there is any emergency that comes up, we're prepared to deal with it. We are staffed, and we will deal with anything that comes up. However, we are discouraging anyone from showing up on routine business that has anything to do with the items I just discussed.
I'm wondering if this situation has caused a decrease in crime.
That's a good question. We don't have a report on that. We don't have a protocol for determining that right now, but I suspect that within a couple of weeks we'll know the answer to that.
Okay. And we were also wondering what has been done as far as protecting inmates who may be incarcerated at the various facilities.
Well, one of the things that in the criminal justice system we are going to deal with, and this is going to be more the judges than the district attorney's office, is getting some of those people out of jail who are low-risk offenders, mostly misdemeanor people who are actually filing to get out of jail anyway, to get their bond set, to be released on their own recognizance or on some sort of low bail, who are not at high risk for reoffending right now. And we are dealing with the judges on a daily basis relative to those issues. And I think the concept is get as many people as can be safely allowed to get out of jail.
There is some teleconferencing going on?
Yes, that's correct. We're trying to do everything we can do in terms of arraignments and hearings of those types by closed circuit television.
What if there's a crime? What if anything is being done to protect a law enforcement officer who perhaps, has to show up at a domestic disturbance?
I think the Sheriff's Department has developed its own protocol for handling those kind of things, and I'm not privy to all of the procedures.
Thank you.
Thank you, ma'am. Thank you.
Thank you, Mr. DeRozier. Just a general comment about government services, and Mr. DeRozier and the mayor have covered some of those, but as far as we know, most government agencies are still open. Some may be at reduced levels of service for various services that they provide. Our suggestion is, if you have some business with one of the government agencies, call that office and describe to them what your issue is, and they'll be able to tell you where that service is available right now. But as I say, all services are still available, except possibly at reduced levels. I had a couple of public safety things we're going to talk about, but in the interim, I just got an email from Jim Rock, who's the executive director for the Lake Area Industry Alliance. And he sent a list of things. He's polled industry, and he sent a list of things, and I think it's worth taking a couple of minutes to read through this list, because it reaffirms that people are taking this seriously. So I'll just read through the list. Social distancing is being practiced by employees at work. Non-essential personnel are either working at home or working in shifts, not all at the site at the same time. Travel is either eliminated or greatly restricted. Control rooms are limited only to operators and immediate supervisors. Visitors are not allowed and only allowed after screening. Anyone feeling ill is sent home immediately. Additional sanitizing of all surfaces within the facility. Cleaning of all commonly used tools prior to employees using those tools or prior to that tool being put into storage. Meetings are either eliminated or held via conference call or video conference. And one that we've gotten some questions about, essential personnel have been identified at some sites in case of need to have a, quote, ride-out crew. Personnel, which means personnel would be required to run the operation that would need to remain on site for a long period of time. And these are, this last practice is a standard practice for industry that they use during times of hurricanes and other disasters. So the reason I wanted to read this list, it covers all the preparedness issues that we're going to discuss. And just to reassure people, since industry is our largest employer, that they are following suit with everyone else. So with that, we'd be open for questions or whatever your desire. Teresa, you got anything else?
I probably do. I can't think of it. I meant to wish you a happy St. Patrick's Day, too.
Thank you. John? Okay, well, that'll conclude today's conference. We'll have another one tomorrow at 11:30.
Oh, I just thought of one more question. I'm
Okay.
sorry. We have received some calls and inquiries from people, and I get the impression the federal government is going to take care of this, but there are still people who are concerned that if they are sent home from work for some reason, maybe they feel fine, but they were exposed to somebody, so they have to go home. They're concerned about being in a position of having to use sick leave that they didn't decide to take, on their own. So I don't know if you would know anything about that, but that is another concern that we've been made aware of.
The only thing we can say on that is we see the discussion at the federal level about those issues. There is no mechanism for that I know of at this time. There may be some other advice for that, but we don't know anything. And I do want to say one more thing. Lastly, we've gotten a lot of calls about curfews or travel through parishes or anything like that. At this time, there are no plans for any curfew in Calcasieu Parish. No roads are closed. To our knowledge, the state has not called for that. So I just want to assure people, if something like that changes, they will know about it immediately if that decision is made. But I don't think we're, due to what we talked about earlier with 911 being normal and sheriff operations being normal, I don't think we're there yet.
Thank you.
Okay, anyone else?
Is this the only briefing today?
This will be the only briefing today, John, unless something happens. We're going to say that every day because the way things are changing, if it's an important enough issue, we may have another one. Okay, thank you.